Hi YouTube, Julie from Indiana, and I'm going to show you a picture of what the Rowan Y gastric bypass looks like. I also went to my educational class on August 13, 2013, and in this first video I'm going to show you the operation risk and complications that could result from the surgery. So real quick, let me just show you this. This is what my stomach is going to look like when we're done. This is the esophagus here. And then you see the top pouch. Down here they bypass the small intestine. They bring the small intestine up and they hook it to your new pouch. So that's what that looks like. I also did find out yesterday during my class that Dr. Evanson makes his pouches very, very tight. He said when you're done, they could be the size of a nickel to the size of a quarter. And I thought I was going to have 3 to 4 ounces. And they told me with Dr. Evanson I will be lucky to have 1.5. So that makes me kind of nervous, but, you know, a good surgeon knows what he's doing, so, you know, 1.5 ounces it might be. Okay, let's go over risk and complications which may result from the bariatric surgery. It says, injury to esophagus, stomach, spleen, liver, or other organs which could necessitate additional surgery or treatment. A spleen injury, possibly resulting removal. Rare infection from spleen removal, for some reason, if they do have to take it out. Bleeding or hemorrhage from any surgical area which could result in the need for a transfusion or other treatment. Anemia, possibly requiring blood. Wound complications such as infection, a fluid blister, collection of blood, or rupture of the surgical incision site. Intra-abdominal hernia or incisional hernia, possibly requiring surgical intervention. Stomach distension or paralysis, temporary or delayed. Hyperactive stomach, rapid emptying. Leak from stomach, intestine, or other surgical areas that could cause peritoneous abscess formation, abdominal abscess, pus in the abdomen. Nausea or vomiting, dehydration requiring IV fluids. Loss of appetite, diarrhea, and or constipation. Difficult swallowing, gas or bloating. Gastric outlet obstruction, blockage or narrowing of the opening of the pouch area, possibly requiring an interventional scope. Food or medication intolerance. A piece of retained food in the upper pouch which could obstruct the passage of food or fluids. An ulcer formation which can result in inflammation, scarring, bleeding, or perforation requiring surgical intervention. Serious hyperglycemia requiring medical and or surgical intervention. Dumping syndrome, diarrhea, sweating, nausea after eating. Gallstone formation, inflammation or infection of gallbladder removal. Pancreatitis with possible pseudodox, I'm not real sure, inflammation in the pancreas. Something looks like pancreas, I'm not real sure there. I'm sorry, I apologize. I should have read this first. Protein, calorie malnutrition, vitamin deficiencies, including but not limited to calcium, folate, thiamine, and B12, trace element deficiencies, iron deficiencies, possibly requiring an iron infusion or blood transfusion, fragile nails, skin rash, hair loss, loose skin, gout, kidney stones, small bowel obstruction, possibly requiring surgical intervention, increased fertility, weight gain from failure to follow dietary guidelines, overstretching of the gastric pouch, staple line breakdown resulting in weight gain, psychological changes with change in body images and eating habits, depression, change in relationships with family and friends, a shift in addictive behaviors that may include drug, alcohol, nicotine use, compulsive shopping, gambling, and or other addictions, eventually returning of overeating due to unresolved emotional problems, deep venous thrombosis, clots in the arms and legs, inflammation or infection of veins, peripheral or central nerve damage, pulmonary embolism, blood clots to the lung or heart, possibly preventing breathing or causing death, pneumonia, respiratory depression, respiratory arrest, cardiac problems, irregular heartbeat, heart failure, heart attack. Additional procedures such as reoperation or an endoscopy, and death. I know that they have to give you this, but literally this is the list, and everything on here is just complications and risk of surgery. So the morning of surgery, I'm well aware of what's on this paper. I will sign one of these and date it before they take me back. I do know that with the proper care, you know, after the proper post-op care and the proper diet, you can avoid many, many, many things on this list. Many things. So I know, like for example, the blood clots. They actually will send me home with a prescription for Lovenox. It's a blood thinner. Jason will have to give me a shot every day of blood thinners. I'm not real sure for how long. Could be 2 weeks, could be 3 weeks. But it's to help prevent those blood clots. Because if they do get loose and they get to your lung or your heart, it is potentially fatal. Very serious stuff. So they already told me that I will have a prescription for that, and I will require a daily shot of Lovenox blood thinners just to prevent blood clots. Not only that, but you have to get up and walk around every 1 to 2 hours. They want you walking to keep that blood circulation so you do not get blood clots. They said it is very, very crucial that you do that because of how quickly a blood clot can form. So anyway, this was my operative risk and complications in a nutshell. On my class yesterday, there was so much information. I'm going to have to break it down in several short videos just to kind of cover everything. But I did want to go over what the Rowan-Y gastric bypass surgery does look like. So this is what the insides will look like when I'm done, and the risk of surgery. So that was video number 1. Thanks, guys. Bye.